This service is called Bindi. Bindi is a word, Sanskrit word from Ayurvedic medicine that means point of origin. It's where all of your health begins, and all of your health begins is being in balance, having nourishment brought to the cells and toxins taken away from the cells. And as long as your little cells are healthy and happy, your body will be healthy and happy, because that's where you live, is in your cells. So this is a very relaxing treatment, but the purpose is to help the body detox. So I don't recommend that you go out and exercise after this service, drink alcohol after this service. You want to give your liver and your body a chance to detox and relax and enjoy the service that you received. So do be careful. I wouldn't recommend you go out in the sun immediately after this service either. This service blends very well with the Shirodhara, and we talked about this with the Shirodhara. You can combine the two, because what this is a wrap, and while your client is in the wrap, you can apply the Shirodhara, and they get a double detoxing plus a very calming and soothing treatment. What we're going to do to start with is we're going to cleanse the skin. With any treatment, there's always 3 steps. First, you treat the skin. You detox it, you prepare it for the service. Then you do your corrective part, the treatment part. You're applying whatever seaweed, mud, the bindi, whatever it is that you're doing to help the body rebalance itself. And then at the end, you're going to protect the skin. So you're going to apply a moisturizer or something at the end to help leave the skin protected. Now this particular service, the bindi, we're going to be wrapping the person inside warm, wet towels to kind of steam them, steam the oil into the skin, and use a very large amount of oil. So at the end of the service, you really don't need to apply more oil unless you think that you do, by judging by the texture of the skin. If they complain of dry skin, or if they told you they have dry skin, you may want to put a moisturizer at the end, but for most people, you really don't. The amount of oil that they've absorbed is pretty much going to protect the skin and not allow the moisture to evaporate off at the end. We're going to use a brush. Now it has to be a boar hair bristle brush, nothing plastic. This is going to stimulate the skin to start the detoxing process. And we're going to brush them according to the lymphatic drainage of the body to help improve the circulation. We're going to use a body product to help take off all the dead skin cells, open the pores, and stimulate the skin, by Bindi. There are others that you could use, but this is a great one to use. It's very easy to use. It is a ground herb mixture that combines with the dead skin cells and helps them slough off. It only takes a tablespoon. You may think you need more, because I usually do, and I usually end up throwing away quite a bit of product. You're going to mix it with water, equal amounts of water, in any kind of container with a spatula. Now the consistency is what's important. I can tell you measurements, but based on how old that product is, moisture in the air, a lot of different things that may affect it, what you want is runny eggs. So if I lift up the spatula, some sticks, but most of it pours off. That's called runny eggs. You can't mix this up hours ahead of time, because it will turn into foam, and you no longer have the gritty particles that are going to help slough off the dead cells on the skin. So only mix this up right before the service that you're going to use it for. We're going to start on the back. We're going to apply the product. Remember, it's not a massage, it's a scrub. While it's drying for 5 minutes, we're going to massage the feet. Then we're going to brush it off, and we're going to apply a massage oil, and you have to be particular about the kind that you use. You need something that has a very high glide, very high slip to it, because you're not going deeply into the tissues. This is detoxing. It's what we call a skin treatment, very similar to lymph drainage. You want to stay in that superficial fascia. So you need to be able to skim across the surface of their body for a number of strokes and still have the glide that you need, that cushion of oil between your hand and their skin. You can use many different ones. The Bindi, you can do it according to their dosha. She has a blend for the oils. Most Ayurvedic treatments are done with sweet almond oil or sesame, but whatever you use, just be sure that it's going to stay on the surface and allow you to glide quickly for a long period of time. You can also do fractionated coconut oil, which works really well, and you can add the aromas to make the dosha specific to it, or the oil can be just plain. It's really up to your preference for that. So we're going to get started. We need the table up a little higher than you would be doing it for a massage, because you're not going deeply into the tissues. You just want good access. I insist that my guests wear disposable underwear. If they wear their own underwear, they're going to get product all over it, and you're not allowed to lie on the table completely nude in the state of Florida. I'm going to take off that top towel, so I need to have something there to protect their privacy, and by law, I could fold this up into what we call a spa drape. If I bring this down, roll this up, bring the legs apart, just twist that up and make sure they feel it down across their hips. Put their hands on top, and you have a spa drape, because you're going to need to get to the entire surface of the body. You can do it this way, or, which is even easier, is if you take a hand towel, you place it here, tuck it into their disposable underwear, hold on to it so it doesn't come with you when you pull this out. Now that's out of my way, and it's clean, and he's not exposed, and I can get to everything that I need to work on. So I'm going to mix up my body treatment, equal amounts of water and treatment, a tablespoon of each. So as you can see, it sticks to the spatula. It runs a little bit off the spatula, so it's not thick like a sauce or a cream. It's a little more watery than that. Make a pool with your palm, pour a little bit in, rub it together with your hands. Let me put this here so I can get to it easily. And apply it. Arch your stance lightly, smooth it onto the skin, and then come back. See, I'm just scrubbing with my hands. I'm not massaging. I'm going to wait till I see it peel up a little bit, like a bad sunburn, and it's combined and taken all the dead skin into the little peels with it. You start to slow down, a little draggy feeling, and you're done. And their skin should redden a little bit. That's called a capillary blush. You want to see that. You want to bring some blood into the area. Just scrub it up and down. Nice wide archer stance. Be over your work till it slows down. Do not put it on the hands and the feet. You're going to be massaging them, so you don't want the product on the hands and the feet. Lightly apply it and back up. Scrub. Now, if they're very, very hairy, you have to apply this in the direction of their hair flow, and I would only scrub in the direction of their hair flow. So if he had a really hairy leg, I'd be doing this to get it in. Scrub, scrub, scrub. It has a wonderful aroma. It smells a little bit like turkey dressing. pressure on the upstroke, centripetal direction, lighter pressure going down. Now, a trick that you have to follow is this has to stay warm. So you're going to have to put this back in warm water or a caddy or something, because you're going to use the rest of this when they turn over. Now, you may want to use a product specifically for the feet if you have a medicated oil. But you're only going to do this maximum of 5 minutes. You have to be very careful when you're doing body wraps, watching the clock. There are many steps to the process. And if you get behind in one, where you shouldn't have taken 5 minutes, but you took 10, that means you have to take that time away from some other part of the treatment. You can combine some what we call abhyanga, that's a Sanskrit word, it just means massage. Techniques on the feet. Support the heel with your thumb, and you're going to do circular frictions on the ankle bone. But what you're trying to do is vertically translate his body. So I'm pushing up and pulling back and pushing up and pulling back. And I'm just rocking into him and using my fingers to move the skin around the ankle. This helps reduce the edema in the feet. It moves the lymph up the leg. Stimulates the nervous system by just pulling on the skin. Now, if we were doing this double-handed, there would be someone on this side doing it and someone over here. Then you're going to tug on the ankle. It's called an ankle pull. Lean back and just pull. And what we call thumb swipes, make an upside down T. 1, 2, 3, 4, 5. Come back and twist into the ankle, into the arch of the foot, where the spine is. And you're done. Now we're going to come back and we're going to take the product off. Be careful how you brush or remove product. You never want to brush it into the floor. Remember, you're the one cleaning the floor, and you only have 10 minutes after the service. So the cleaner you are, the more careful you are, the less work you have to do. I'm going to follow his lymph system though. So I'm going to start on the legs, and I'm going to brush up. It goes to either side, and then you're going to take it towards the groin area. The lymph runs into the groin nodes, so it's in this direction. Now, this product is part of the treatment, so I'm not going to get it all off. I don't want to take all of it off the skin. Other services you would, but not this particular one. Now, you could have dry brushed first and then applied the product. It's up to you. On the back, it goes across. Top of the shoulder is a little triangle. This, you're going to take it over the shoulder, Arms are like the legs. You just bring them up and you bring it towards the armpit. That's where the nodes are. In Ayurvedic treatment, you use a lot of oil. Other training, they say just enough to have a glide to the skin. You want to be able to stretch the skin. But in these treatments, you're going to want to use as much as you possibly can. So we're just going to pour that warm oil all over his lid. And we're simply going to do some effleurages. 2, 3, 4, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 20 to 30 strokes. One, two, three. When I get to the top, I'm not going into the groin, but I'm kind of pushing it in that direction. Light pressure back, deeper pressure up. But I'm not working into the muscles. Remember, this is not a muscular treatment. You're trying to stay in the lymphatic system, which is right under the skin. That feels good, though, doesn't it, Arthur? To have that warm oil trailed over your body. So you want to make sure all those little granulars are nice and coated, so they don't. You want them to scrub, but you don't want them to like irritate his skin. One, two. Be careful of the elbow. Now, you notice how much oil I use, and my hands are pretty oily. Even if I stopped and tried to clean them off, there's really going to be a lot of oil. Normally, we wouldn't put a pillowcase on a bolster, but because you're so very oily, I would recommend you put a pillowcase on it. Be sure the feet are uncovered. Now, if you're in a room by yourself, there's going to be no one over on that side of the table. So all you have to do is basically lift the towel up. If you're in a room that's kind of open, you want to make your tent so that he's protected on that side as well as this one. Okay, Arthur, honey, I want you to bring this shoulder to me. I want you to turn all the way over onto your stomach. Remember, you watch the feet as they turn to make sure they're not getting tangled up. All right, now I want you to scoot down so that your head's on the table. That's good. You lift your head up for me. Okay, hi. Now, if we're going to do the Shirodara, we still aren't going to push him into that position. I don't want him to be lying there for the 2 hours or hour and a half with his head lower. So I do make him comfortable for this treatment. Then when we do the Shirodara, we'll readjust his position. Always secure the head first, then the knees. Bend your knees up for me. Would you like an eye pillow? Walk out the light.
Yeah, that's fine.
To help him relax, I'm going to put an eye pillow across his eyes. Remember, nothing goes directly on the eyes. You always have to protect it. So we're going to put a Kleenex there, and then the eye pillow. So we're going to do what we did before.
Yeah, that can be whispered. Oh, really sensitive mind.
We're going to do what we did before. We're going to get the towel out of our way because it's rather bulky. So you're going to tuck this into their disposable underwear. Make sure that it doesn't come with the towel. And get the towel out of your way. So I kept the body treatment warm. I put it in some warm water. Pour it into your hand, rub them together, and apply it lightly. Remember, it's not a massage, you're just scrubbing. Now on the chest, everything is going towards the armpit. So we're going to bring our strokes like this, across his deltoid muscles, but towards his armpit. The stomach is just a big oval. But you want to bring it in the direction of his colon flow. So this is what we call a sun and the moon. But you're just going to make sure you go clockwise. So you're coming across his transverse colon in the direction that his digestion takes place. Arm is the same. We're just going to come up, aim towards that armpit. Nice open stance so you're comfortable. And you're scrubbing and you're pushing because you do want to pick up the skin. You want to get all that dead skin to come into the product so that it rolls it up and takes it off. Up the arm, apply it, come back and scrub. No set number of strokes, you just do it until it begins to feel tacky. And we're done with this, so we can throw away the rest of the product. And we'll massage the hands. Now, there's a table warmer on the table, and you can turn it up for this service if they feel a little chilled. If they still feel uncomfortable, cover them with the towel. So a minute, minute and a half per hand. Be comfortable. This is a chance you can take a break. So you can sit on the edge of the table. Pull a stool out, put one foot up on the stool. Ayurvedic treatments, they like to twist and pull the digits. You want to work that web and the palm. Interlace your fingers. Support the base of the wrist and hyperextend to stretch the hand out. Bring your support hand up to the MCPs. Bring it back again. To the PIPs and to the DIPs. Thumb. Now, I don't have to do it in the same order, but if I stretch that hand, I have to stretch this hand. If I rotated the fingers over there, I have to rotate the fingers over here. And if you have a massage therapist on the table, you want to be really mindful of that thumb. Now we're going to brush the exfoliant off. Following the lymph system, start with the legs, and you're still going to aim it towards the groin area. Because posterior anterior, it still goes towards the nose, which are in the groin. Remember, you don't have to get all of this off. Those granules are part of the treatment. So we're going to pour a stream of oil, follow it with our hand, rub it in. This also feels good. There's a complete Ayurvedic massage that's done just with streams of as hot as they can take it oil. Sometimes wax. If you ever had it done, you'll love it. It sounds gross, but it really feels good. Don't actually go into the groin area, but that's your intent. So you're curving your hands to take the oil into that area. Clockwise circles. Come up and off the chest towards the armpit. When you're using the top towel, remember to have the same side towards their body each time, because you're going to use this at the end and you're going to turn it over and use the clean side. So I've had the 2 large towels being kept warm in the caddy. About 98 to 100 degrees is what you want. Higher if they can tolerate it. Now, when they sit up, we're going to pull out the dirty towel from under them, and we're going to put the hot towel. But the place that you really want to protect from the heat is the small back. So unless they really like heat, I'm going to put a little dry white towel at the base of their spine to keep the heat off that one area of their back. Okay, Arthur, honey, I want you to sit up for me, please. And lean forward just a little bit. Roll up the dirty towel as close to their spine as possible. You're going to leave the mylar on there, and you'll notice this shiny side is up. Wherever you want heat to be reflected back from, that's where you want the shiny side. So I want to hold all that heat in, so I'm going to keep that side towards his body. Now this only needs to go up to their décolleté, which is armpit to armpit. So you're not going to put this under his head, but we're going to do what we call an accordion fold. I'll put the base there and let it just drop down as an accordion. And then not all the way up to his neck, but just at his shoulder line. Right there. Going to put this and hold it at the base of his spine. Okay, Arthur, I want you to lay back down. Now, dig your heels into the table and lift your hips up off the table. We're going to pull the dirty towel out, rolling it up so you don't get all that in the floor. Make sure this is positioned under his low back. Hold on one second. And then we're just going to pull this down. There you go. One more time with that. Okay, now, is that okay? Mm-hmm. Okay. Be careful with this because remember this is full of gritty stuff. Just make sure you ball it up. Okay, lift your legs off the table and we're going to pull this towel down the rest of the way. Lift your feet up. Perfect. Okay. You sure that's okay? Mm-hmm. Feels good, doesn't it? Mm-hmm. Heat is wonderful. Now open this up and put it on top of the other one. Let them get accustomed to the heat. And now I'm going to pull that bottom towel out from under the top one. And let me know if that's too hot, okay? Just like you did the little towel for your draping on the groin area, you're going to do the same thing. Hold the top towel in place, pull the bottom towel out. Now remember which side you had against them, because when you put this back on, you're going to turn it to the clean side. Arthur, would you like to leave your arms at your side or cross your chest? This side. Shiny side down, that's where we want the heat. At the décolleté line. Now, you're going to roll up the bottom mylar, getting the wet towels inside so they're not showing, and pull the top one over and tuck, just like a TV dinner. If you start at the bottom, it's easier. Lift and tuck. Lift and tuck. Roll the bottom up. Bring the top over. Lift and tuck. Lift and tuck. Lift and tuck. Now up here, you don't want wet towels showing. You want to try to keep that heat in. So everywhere I see the towels, I'm going to cover it with the Mylar. Put another dry towel across the top and tuck so that they don't feel a piece of plastic against their skin. Now, if you want to hold even more heat in, you want to keep it from coming off the top of their head, you can make a little hood. Just like that. You want to leave them wrapped up for 10 minutes at least. 20 minutes is ideal. And now that they're wrapped up, if I didn't have this here for heat protection, I could do the Shirodara. So while they're relaxing in the wrap, you can also be doing the Shirodara for them. If you include all of this with a foot and hand massage, we would call that a Nirvana treatment. And you can charge for 3 different treatments because that's what you're doing. It would be at least 2 hours, maybe 2.5 hours. So if someone wants to come in and just spend the day at the spa and walk out totally relaxed with completely new, fresh feeling skin, this is something you could recommend for them. He's been able to be in his wrap for at least 10 minutes. We've done the Shirodara treatment. So now we're going to get him out. This is the hard part. I'm going to take this off. Now, with every treatment that you do, you really don't want your client moving around a lot. You don't want them sitting up and laying down and sitting up and laying down. So you want to try to organize everything, so keep that at a minimum. But what we're going to do with this treatment is we have to take it off. So we want to be able to remove it from his skin and have him end up lying on a clean towel. So if we do need to moisturize or whatever else we need to do at the end, he's able to do that because he's now on a clean surface. So we're going to take this off. We're going to undo the sides so that they're separate, so I can remove them separately. We're going to take 3 warm hand towels. Remember, test it on the inside of your arm first, and then touch them with it and see if the temperature is okay. Is that okay? We're going to put this on the chest area, top down. This is the most sensitive part, so I'm going to lay it there first. Last. Then we're going to put 1 on this arm, and 1 on the other arm. We're just going to press the heat into the body. Always hold the edges away from their skin so that they don't feel that in case it's gotten cold. If they're wearing navel jewelry, be very careful. that side, this side, fold it over to the clean side. So now you have 4 more surfaces you can use. Press, hold at the wrist and slide the towel down. Turn it over to the clean side, come up to the shoulder. Do it again. Open it up to the other side, the inside, which is clean. Hold the arm away from the table and clean the underside of the arm. Make sure you get the elbow really good. Now, before you put that arm back down on the table, you're going to roll up the Mylar so that the clean surface of Mylar is facing up, and you can put the arm down on that. So that arm is on something that's clean. Compress, slide down, turn it over, come up a little higher, get the shoulder, down some more, open it to the clean side, hold the arm with your superior hand, clean with your inferior hand, roll the Mylar up against his side and put the arm down so it's on a clean surface. Now, they may be a little chilled and you don't want them to be chilled, so I'm going to go ahead and recover his chest with the clean towel, and I'm going to put the clean side down, the one that has not touched him before now. And we can just keep peeling that Mylar down and the towel. Get that out of your way. You can do both legs at once, but you have a problem with maybe that other leg gets too cold when you're doing this leg, so I prefer just to do one leg at a time. So just like with the hand, we're going to hold it at the ankle and we're going to push everything down to the foot. Turn it over to the other side, put it back against the leg, push it down, fold it in half and open it up so that now you're on the clean side. You're going to come into the leg, clean the inside of the leg and the outside of the leg. Before you put him back down, you're going to roll that up so that his leg is back down on the clean surface. And you can bring this down. Make sure he stays warm. Compress, compress. Now, it's real important that you learn to clean as you go, because when I've done that, I have like a minute. I could pick up some things around that I'm not going to be using anymore and get them out of my way. The ones that he was lying on that had product on them, you're going to have to shake them out before you put them in your laundry. So keep them together in a ball. Do not put them in your laundry, your washer until you shake all that out. If you're using a product like seaweed or clay or mud, I would recommend you take those towels to a laundromat. You don't want to put those through your washer. Open it up to the clean side. Pick the foot up. Inside the thigh. Switch hands. And turn it over. Outside. Now I'm going to roll this up so that he's lying on something that's dry and clean. Now lift your hips up for me off the table, dig your heels in, lift your bottom, lift your bottom a little more, there you go. Okay, now put your legs back in. Lower the table. I didn't notice that he needed a moisturizer. He seems just fine. His skin feels great. Okay, Arthur, have you sit up for me? Lean forward a little bit. Temperature okay?
Mm-hmm.
Now here you can spend a little time with them. The last thing they're going to remember is that nice little back massage you gave them. Their upper traps, their neck. You're going to bring that towel down. Turn it over, bring it down again, and then go back. If you see anything, a little shiny area, maybe some granules are still there, go back and pick them up. Okay, hon. Turn around and bang your feet off the table for me. Is that okay? Should I lower it down a little bit more?
That's good.
Okay. Make sure they're okay, because when they've been wrapped up in something like this for this long, the heat, I don't care who you are, your blood pressure is going to lower. So they may be a little lightheaded, a little dizzy. So you want to have your hand on their shoulder. Be sure they look you into the eye and that they're okay before you let go of them for them to stand up. Tell them to stand up slowly and get dressed, and that you'll meet them right outside. You have some water or some tea for them. When you're doing a detox, you want to give them something warm. The warmth in the stomach helps them to continue to detox. A little safety point is don't have their clothes lower than the table. Because once they stand up, you don't want them bending down to the ground to get dressed. So if you have a robe for them, go ahead and put the robe on. You can stand behind them and help them into their robe. If they brought clothes with them, be sure they're up high, even with the table, or you bring them to them so that they can get dressed sitting here at the table. Lower the table enough to where all they have to do is slip their shoes on. It's just really important that they don't do any bending once they've had their treatment done. Okay?